Now we shall discuss why exactly we shall use sodium fluoride as the anticoagulant of choice. Now what happens whenever inside the RBC, if this is the RBC, in RBC a process called glycolysis constantly takes place. What they'll do is they'll use glucose to make ATP. So when you collect blood in a test tube, RBCs are there. All the RBCs will use up glucose and ultimately the glucose level will fall. So we must prepare the blood sample in such a way that glucose do not get used up when we store the glucose, store the blood sample before estimating the glucose. So what we do, we use an anticoagulant sodium fluoride which specifically inhibits glycolysis process. That means what? Sodium fluoride will stop the glycolysis by inhibition of a key enzyme which remains inside the glycolytic pathway. That means sodium fluoride will inhibit an enzyme of glycolysis, and therefore whatever glucose is present in the blood sample will keep constant. Otherwise what will happen? All the glucose will used up by means of RBC, and therefore you will get a lower value of blood glucose. Therefore we shall always use sodium fluoride before estimating blood glucose if we using a which sample? Plasma sample. But if you are using a serum sample, which you have to do instantly or in a very small period of time, we can directly use the serum sample.